Good morning, everybody. I'd like to call this meeting of the House Health Committee to order. Devin, would you please take the roll?
Chair Frankel.
Here?
Representative Benham. Here. Borowski.
Designation? Oh, she's here? Oh, yeah, all right.
Boyd. Here. Hambidge.
Designation?
Howard.
Designation?
Khan. Here. Gazarovski. Here. Grajewski.
Designation?
Mays.
Designation?
Otten.
Designation?
Sanchez. Here. Schusterman. Here. Venkat.
Here.
Chair Rapp.
Here.
Representative Bonner. Here. Borowitz.
Here.
Brown.
Designation?
Day. Here. Krupa.
Designation?
Roy.
Here.
Rossi.
Here.
Stair.
Here.
Twardzik.
Designation?
Walsh.
Here.
Zimmerman.
Here.
You have a quorum.
Thank you, members. The chair calls up House Bill 446, printers number 424, sponsored by Representative Sanchez. Dylan, would you please describe the bill? Provide a summary. Thanks.
House Bill 446 amends the Healthcare Facilities Act to require healthcare facilities to offer patients the remaining portions of medications that they were administered and billed for. The medication must be labeled in accordance with current law, and if the medication is prescribed in an emergency room or operating room, the prescriber must counsel the patient on how to use it properly. The medications included in this bill are topical antibiotics, anti-inflammatories, eye drops or ointments used for dilation or glaucoma, and nasal sprays.
The question is, will the committee report House Bill 446? Representative Sanchez is offering Amendment A01274. Dylan, would you please provide a summary of the amendment?
A01274 makes the following changes. It narrows the scope from applying this bill to all healthcare facilities to instead hospitals and ambulatory surgical facilities where the administration and dispensing of partially used medications are most likely to occur. It ensures medications can only be offered if their continued use meets the standard of care. It specifies that the information of inpatient labels is sufficient for labeling purposes, and instructions for use must be included in discharge paperwork so that the facility does not have to create a new outpatient label. It provides flexibility in fulfilling the pharmacy counseling requirements by allowing the prescriber to satisfy those requirements. And lastly, it provides licensure and liability protections for facilities adhering to this act and expands the list of medications allowed to be offered to take home.
Thank you, Dylan. Will the committee agree on to the amendment? On that question, the chair recognizes Representative Sanchez.
Thanks, Mr. Chairman, and thank you to the chairs for calling this up and the committee for your attention today. And this is, Dylan, of course, nailed it in his description, and a very simple thing. You know, we've all probably had a medical procedure or taken somebody for a medical procedure, and they'll use some medicine in the process and procedure, and this will allow patients to basically walk away with that medicine for continued treatment under, you know, obviously certain controls and conditions. You know, very simple concept, much like any simple thing. There's a lot of concerns and trip hazards along the way, and we want to commend everyone involved, particularly the staff, for working with all the stakeholders on this. Every stakeholder we talked to recognized the importance of this legislation, wanted to see it get done. We worked with the hospitals, pharmacies, Department of State, Department of Health, the Medical Society, emergency physicians, and even trial lawyers on this, and ensuring this is really in a good spot. So a great negotiated product. It's going to help with efficiency, reduced waste, and, you know, if you've ever been to the ER in the middle of the night, or I guess even in the middle of the day, it's be much more convenient because you may not have to stop at the pharmacy on the way home. Just, you know, follow the instructions as directed. So I'll leave it at that, and thanks again. Would appreciate everyone's support.
Thanks. Are there any other comments on the amendment? Chair Rapp?
Thank you, Mr. Chairman. It's my understanding that this is and was negotiated with stakeholder groups, and that it seeks to clarify certain provisions relating to patient counseling, labeling requirements, discharge instructions, and liability protections. And I will be supporting the amendment. Thank you, Mr. Chairman.
Thank you. As has been explained by those, that's a great deal of stakeholder engagement that was involved in this amendment, and I'd ask members to support the amendment. Is there any opposition to Amendment A01274? See none. The amendment is agreed to. The question recurs. Will the committee report the bill as amended? Is there any discussion on the bill? And on that question, I'm going to recognize the prime sponsor, Representative Sanchez.
And nothing more to add than what I've already said, Mr. Chairman. Thank you, and would appreciate everyone's support.
Now, before I turn it over to Chair Rapp, any other members have comments or questions? Chair Rapp.
Thank you, Mr. Chairman, and thank you, Representative. I believe it's a common sense piece of legislation, and I will be supporting moving this bill out of committee today. Thank you, Mr. Chair.
Thank you. This bill came to us from the frustrations of physicians who were required to throw medication a patient needed into the garbage and then tell the patient to go to a pharmacy to buy that same item. This is a common sense bill to reduce hospital waste, and I ask for a yes vote. Are there any negative votes on House Bill 446? See none. House Bill 446 is, as amended, is reported affirmatively from the House Health Committee. Thank you all. The chair calls up House Bill 348, printers number 303, sponsored by Representative Bonner. Mike, can you please provide us with a summary of the bill?
Thank you, Mr. Chairman. House Bill 348, introduced by Representative Bonner, amends the Human Services Code to require long-term care nursing facilities to provide a standard notice to each resident or their designated representatives at the time of their admission regarding the option of having legal representation to assist them with the application for Medicaid benefits. The bill further requires the Department of Human Services to post the notice on its publicly accessible internet website in multiple languages or formats that it deems necessary to ensure that residents or their designated representatives can read and understand the notice. A long-term care nursing facility may use the form developed by the department or use its own form, provided it meets the requirements of this bill. Thank you, Mr. Chairman.
Thank you, Mike. Is there any discussion on the bill? On that question, the chair recognizes Representative Bonner.
Thank you, Mr. Chairman. 70% of all adults over the age of 65 will spend some time in a nursing home. And the average cost of skilled care in a nursing home in Pennsylvania now amounts to $130,000. Many people in a nursing home will spend all of their life savings and sell assets to pay for this care. But the Medicaid program does not require individuals to spend down all of their money, and some of them even going bankrupt in incurring the costs of care. There are exemptions under the Medicaid law that does protect assets of an individual in a nursing home. So, for example, 70% of the value of a house can be typically protected. Gifts can be made to disabled children or children who are living in the home taking care of parents that keep the parents out of the nursing home. 1/2 of the marital assets can be protected for the spouse who is living at home. And the retirement income of the spouse at home, including IRAs and Social Security and pensions, also does not have to be spent on nursing home care. But many people do not realize that they do not have to spend down their assets. And when I have seen them in my office, unfortunately, they have spent their life savings and even sold their home to pay for nursing home care. When an individual goes into a nursing home, they fill out an application, and at some point they may become eligible for Medicaid assistance. But the nursing home is not permitted to give legal advice, and sometimes the direction they give is not accurate. So this legal provision will require the nursing home to give notice to the patient that they may want to talk with an attorney about options they have to protect assets at the time of their admission into a nursing home. So it can be very stressful in the final days of life, and even more so as patients and families are spending down assets. And this bill will at least notify patients that there may be some options there to protect assets as they go through this trying ordeal. And I would respectfully ask for your support on the legislation.
Thanks, Representative Bonner. Any other discussion on the bill before I turn it to Chair Rapp? Yes, Representative Schusterman.
I want to thank the maker of the bill. This is a critical piece of legislation. It's as you mentioned, it's an incredibly stressful and time-consuming period of a caretaker's life, and if they understood that by just speaking to counsel, they might change some of what they would do, and it might alleviate some of the financial stress, not all of it. It's a very expensive time and emotional time. So I thank the maker of the bill. I think this will really help the caretakers in the Commonwealth. Thank you.
Chair Rapp.
Thank you, thank you, Mr. Chairman. Thank you, Representative Bonner. I know you're very passionate about this topic and protecting elderly individuals in our Commonwealth. And I think this bill will help give guidance to families when they're in this situation. It doesn't mandate that they seek legal advice, but it does give them the option, and I would hope that we could see an affirmative vote on this piece of legislation. Thank you, Mr. Chair.
Thank you, Chair Rapp. I concur with those comments. This legislation has passed the House in 2023 and 2021. Hopefully we can get this moved forward over to the Senate and get this enacted. I'd like to ask members for a yes vote. Are there any negative votes on House Bill 348? See none. House Bill 348 is reported as committed. Thank you, members. We next have a group of resolutions deemed non-controversial by the chairs. I'm going to call up House Resolution 262 first, and then the rest in a package. Representative 262, sponsored by Representative Schusterman, and designates October 2025 as Menopause Awareness Month. The question is, will the committee report House Resolution 262? Those in favor of House Resolution 262 will vote aye. Those opposed, no. Devin, will you please call the roll?
Chair Frankel,
Yes.
Representative Benham.
Yes.
Boyd. Borowski.
Yes.
Hambidge.
Designation yes.
Howard.
Designation yes.
Khan. Yes. Kozarowski. Yes. Krajewski. Yes. Mays.
Designation yes.
Otten.
Designation yes. Is she? Oh, you're here. Sorry.
Sanchez.
Designation yes.
Schusterman.
Yes.
Venkat.
Yes.
Chair Rapp.
Yes.
Representative Bonner. Borowitz.
No.
Brown.
Designation yes.
Day.
Yes.
Krupa.
Yes.
Roy.
Yes.
Rossi.
No.
Stair.
Yes.
Twardzik.
Designation yes.
Walsh.
No.
Zimmerman.
Yes.
Resolution 23-3 passes.
House Resolution 262 will be reported as committed. The next resolutions will be voted on as a package. House Resolution 256, introduced by Representative Fleming, designates November 2025 as Diabetes Awareness Month. House Resolution 261, introduced by Representative Weeknick, designates July 22nd, 2025 as Hemihyperplasia Awareness Day. And finally, House Resolution 264 from Representative Mulligari recognizes September 2025 as Thyroid Cancer Awareness Month. Oh, that's a correction on the first one is House Resolution 257, not 256, Diabetes Awareness Month. The question is, will the committee report the package of resolutions? Are there any negative votes on the resolutions? Oh, then we will have a roll call. Devin, will you please call the roll?
Didn't say anything. I'm sorry. Mr.
Chair
Chairman,
Frankel.
I didn't know.
Should we just do one bill or? All of, okay. All right, call the roll.
Chair Frankel.
Yes.
Representative Benham. Borowski.
Yes.
Boyd.
Yes.
Hanbidge.
Designation yes.
Howard.
Designation yes.
Khan. Yes. Kozrowski.
Yes.
Krajewski.
Yes.
Mays.
Designation yes.
Otten. Sanchez.
Designation yes.
Schusterman.
Yes.
Venkat.
Yes.
Chair Rapp.
Yes.
Representative Bonner.
Yes.
Horowitz.
Yeah.
I'm sorry. I didn't catch you. Okay. Brown.
Designation yes.
Day.
Yes.
Krupa.
Yes.
Roy.
Yes.
Rossi.
Yes.
Stair.
Yes.
Torzik.
Designation yes.
Walsh. Zimmerman. The ayes are 25, the nays are 1. House Resolution 257 passes.
There's more than one.
261, okay. I'll go fast.
It's 3 resolutions.
Oh,
Right.
on each? Okay.
Right.
So, House Resolutions 257, 261, and 264 are reported
Right.
as committed.
Okay, House resolutions as 257, 261, 264 reported as committed. Seeing no further business, this House Health Committee voting meeting is adjourned. I expect, and by the way, I think this should be the last meeting of the House Health Committee until the fall. I can't guarantee that, but in all likelihood, this will be the last one until we get back here in September.
I will speak to Representative Walsh.
Okay.
I don't think he understood.
That's okay, no problem.
Sorry about that.